Knock, knock on the door. Hi, how's it going?
Good.
Good. I'm Chris. I'm going to be your nurse today. I'm going to go ahead and draw this drape around your bed for patient privacy. And I'm going to go ahead and put some hand sanitizer. I'm going to lower the bed. It looks like it's already there at the lowest position for patient safety. Can I have you verify your name and date of birth?
Kinder Miller, 52788.
Okay, perfect. And I'm going to check your wristband here. And it looks like that's verified with your name and date of birth. So today it looks like we're going to be doing a physical assessment head to toe. And that's basically just a head to toe assessment, and we'll run through it. While I'm doing that, I'm going to be telling you what I'm going to be doing. So do you have any further questions before we start?
No.
Perfect. Okay, so I'm going to ask you some questions, and if you can just answer them. Can you tell me what today is?
September 27, 2020.
Okay, and then can you tell me who our current president is?
Donald Trump.
And then can you tell me where you're at currently?
My in-laws' house.
Perfect.
The hospital, wherever I'm supposed to be.
Okay, and then I'm going to ask you some questions that may be a little more difficult to answer. So do you have any issues with safety at home?
No.
No. Okay, and then as far as sleeping patterns, have you had anything recently change as far as having a hard time to fall asleep or waking up? Nothing?
Nope, I'm sleeping normally.
Okay. And as far as your emotional state, have you had any depression or loneliness? Nope. What about stress or anxiety?
Nothing more than normal.
Nothing more normal. Okay, perfect. Well, we're going to go ahead and start assessing your body. I'm going to start with your head. I'm going to go ahead and palpate your head here. Do you have any pain?
No.
No. Have you had any recent headaches, migraines? No. So it looks like your scalp is clear of no debris and dandruff, and it looks like you have an evenly hairline, and that looks good. And then I'm going to go ahead and palpate your sinuses here. And do you have any recent allergies?
No.
No. Okay. All right. I'm going to go ahead and assess your eyes. So I'm going to use a light here. And if you can just look at my finger. Okay. Now if you can just follow the light. Okay, looks like your pupils are equal and round and reactive to light. We're going to go ahead and look at your ears. Okay, your ears, looks like there is no sign of excessive drainage or debris coming out. I'm going to go ahead and look at your nose. So if you can just look up, and looks like both nasal airways are clear, no sign of debris. Looks like there is a moist mucous membranes, both pink. And I'm gonna go ahead and look at your mouth. I'm gonna check your dentition. So if you can give me a smile. Looks like your teeth are straight, white, intact. I'm gonna look at your gums here. Looks like there's no inflammation, both pink and moist. And if you could open your mouth already, looks like you have a soft palate. No inflammation there, pink and moist. And I'm gonna go ahead and kind of check your jawline here. If you can just open your mouth, perfect. Looks like we have a strong bilateral jaws. um, we're gonna check for your gonna check here for your lymph nodes. And doesn't look like we have any sign of swollen lymph nodes. And if you could just raise up on my hands, perfect. And if you could press against my hand, press against here. So it looks like we have strong, equal, bilateral on both of those. I'm going to go ahead and assess your skin right now. I'm going to check for warmth. I'm going to look for temperature, color. It looks like your skin is dry, intact. It's pink. And I'm going to check for your turgor. And no sign of tinting. And I'm going to go ahead and have you lay down. I'm going to assess, or sorry, I'm going to keep you up. I'm going to assess and listen to your heart. And I apologize, I can't find my stethoscope at the moment, so this will be something I will use temporarily.
We think our niece brought it home. We'll find it.
So this will be something that I'm pretending. So I'm going to assess your heart. Have you had any issues with any shortness of breath, any family history with heart issues?
No.
Okay. So I'm going to go ahead and listen to your heart. If you can just take normal breaths. Now I'm going to listen to your apical pulse for a minute. Okay, minute is up. It reads 70, so that's in a normal range. That's good. So now I'm going to go ahead and listen to your lungs. So I'm going to go ahead and listen to your lungs here. Again, every time I place it here, just take a deep breath. Okay. And I'm going to check your posterior. Okay, lungs sounds are clear, no signs of or sounds of crackles or wheezing. And as far as your heart, S1 and S2, there's no signs of murmurs or rubbing. And I'm going to have you go ahead and lay down on the bed. So I'm going to be assessing your stomach, abdominal area. Alright. I'm going to raise the bed up, if I could, at the hospital and assess the patient's stomach. I don't see any clear signs of abnormalities, detention, or anything like that. I'm going to go ahead and listen for normal bowel sounds. Go ahead and take deep breaths when I press. It's got normal bowel sounds in 4 quadrants. I'm going to go ahead and lightly palpate your stomach. Let me know if you have any pain. Okay, and then have you had any issues with your bladder? Any problems urinating? Any blood? No? And then as far as your genitalia, female genital area? Any issues there?
No.
Okay. All right. I'm going to go ahead and assess your lower extremities now. I'm going to go ahead and check for warmth here. So both equal, bilaterally good. No signs of bruising, lacerations, abnormalities, edema. I'm going to go ahead and check the pulse and the pupil extremity here. Normal. Okay, I'm going to check your capillary refill, less than 3 seconds. I'm going to go have you press down on my hands, press up. Both bilaterally equally strong. I'm going to go ahead and let's see. We're good there. Let's go ahead and have you stand up. Alright. Actually, let's have you sit down real quick. Let's check your capillary refill on your hands. Should have done that beforehand. It looks like less than 3 seconds. Let's check your radial pulse. Both strong, bilaterally good. Okay. All right. Let's go ahead and let's have you stand up and put your hands out. Press down on my hands. Now push up on my hands. Okay, good. Both strong. No signs of weakness in the upper body. Let's have you go ahead and just walk to the wall and back and check your gait. Okay, patient presents equal and good strength in body movement. And I'm going to go ahead and have you touch your toes. Check your spine, normal curvature, and APT ratio 1 to 2. Okay, have you stand up and have you sit back down. And I'm going to go ahead and send this report into the doctors. Any other further questions before we move further?
No.
Okay, sounds good. Thanks.